Mohammed Munir. He is a virologist at Lancaster University in the UK. Thanks so much for being with us. Is this it? Can we start to relax now?
Well, I think it is really good start. I think these initial results are really exceeding the expectation, and I think this is a watershed moment, really, because not only in the scientific community but also the regulatory bodies, what they've been expecting was 60 to 70% expected efficacy, and now having more than 90%, I think this is really a great news.
Okay, so when do you actually expect it to be widely available?
Yeah, well, that is a really important question, Andrea. That well, the first thing I would like to emphasize is that this is not the moment to relax, because this is just the initial result and on only 94 patients, or basically the volunteers. Still, the data has to expand to the level where we see around 164 people protected against this infection before we can really conclude this phase 3 trial. But the anticipation is that the time that has passed for initial 94, that basically at the end of this month we will have data enough out of this trial that will go into the regulatory body for the approval. So in this year, this will be approved, and probably initial stages of distribution will start. But really what we are looking at is the first quarter of 2021.
Okay. So tell us a little bit more about what you think we will still have to do collectively, for prevention before this vaccine is made available to the public. And also, could there be a risk still of a mutation that might throw all of this off?
Absolutely. This is very important. While this is a good news that it is exceeding the expectation in terms of efficacy, but this is not yet done deal. We still have to watch this one very carefully before this vaccine come into the market. And even if it come into the market, still there would be a time before we start seeing the protection. So the message still is the same. Avoid crowded places, wear face masks, and avoid indoor places, and keep personal hygiene at the level where it is already required, and we have learned enough. Vaccine is not yet available, although we have very good results.
Okay. There were a lot of other also vaccines in the works. We knew Russia had claimed to have one that they said was going to be first to the market. Apparently there's some work being done on that vaccine in Brazil, along with the Chinese vaccine. Do you think this Pfizer-BioNTech one, though, is the key one to keep our eyes on for proper distribution to the public?
Well, this is the first vaccine, certainly, that have released the data from the phase 3, which is the last stage trial. But yet we have 3 or 4 other vaccines. Those are running almost in parallel, and in coming weeks they will be releasing their data. For example, the Moderna vaccine that is also running in parallel with the AstraZeneca vaccine. Novavax is starting the trial in the UK as well, and also the Chinese vaccine. So I think the vaccine, there will be a range of vaccines that will be providing the data on the different level of efficacies. But one thing I would like to emphasize here is that one vaccine isn't enough to immunize at least 70% of the population. So this means that even if the Pfizer would be the first one to be approved, yet we need at least 3-4 more vaccines to be approved in parallel in a month or 2 months' time, so that these can be rolled out at the scale when we will immunize the population that is required to establish immunity and also to break the transmission of this virus. So certainly not need to be watched in the coming time.
Okay. Dr. Mohammed Munir joining us there. Thank you so much for that.